How to use self-compassion to heal from trauma bonding. Have you ever felt trapped in a cycle of emotional pain, especially in relationships that seem to pull you in despite the hurt? This experience is often linked to trauma bonding. Trauma bonding occurs when a person forms a strong emotional attachment to an abuser, characterized by cycles of abuse and reconciliation. Healing from this can be challenging, but self-compassion can play a vital role in your recovery. Self-compassion involves treating yourself with kindness and understanding, especially during tough times. It activates the brain's self-soothing system, which helps reduce fear and anxiety that often accompany trauma. Instead of confronting painful memories directly, self-compassion encourages you to accept and care for yourself as you are. This gentler approach can be less overwhelming for those dealing with PTSD or trauma bonds. One of the first steps is to recognize and acknowledge your feelings without judgment. Trauma bonding can lead to confusion, guilt, and self-blame. Practicing self-compassion means noticing these feelings without criticizing yourself for having them. This mindful awareness helps break the cycle of negative self-perception, allowing you to see your experiences as part of a shared human condition rather than personal failings. Next, practice self-kindness. When self-critical thoughts arise, respond with kindness. This could mean comforting yourself with reassuring words or engaging in soothing activities. Remind yourself that healing is a process. Self-kindness counters the internalized messages of blame and weakness that trauma bonding often reinforces. Cultivating a sense of common humanity is also essential. Understand that trauma bonding and its emotional aftermath are experiences shared by many survivors. This realization can reduce feelings of isolation and shame, helping you feel connected rather than alone in your struggles. Recognizing that suffering is a universal experience can foster resilience and encourage you to seek support. Engaging in guided practices can enhance your ability to soothe yourself. Mindful self-compassion meditations or compassionate mind training can be beneficial. These practices have been shown to reduce PTSD symptoms and improve mood by shifting your internal dialogue to one of gentleness and care. However, integrating self-compassion with professional trauma-informed therapy is crucial. This combination addresses the complexities of trauma bonding safely and thoroughly. Lastly, be patient and consistent with yourself. Healing trauma bonds is a gradual process. Self-compassion encourages you to navigate setbacks and progress with patience. It allows healing to unfold at your own pace, reducing the internal stress that can exacerbate PTSD symptoms. In summary, self-compassion can be a powerful tool in healing from trauma bonding. It provides a safe internal space to soothe distress, challenge self-critical thoughts, and foster emotional regulation. By treating yourself with the kindness often lacking in abusive relationships, you can dismantle negative self-perceptions and shame, supporting your recovery and growth. Remember, healing takes time, and it is okay to seek help along the way.